Nursing homes across the country have been especially hit hard throughout the pandemic, and that's the case in Florida as well. The latest numbers there from the state's Department of Health pointing to 9,500 positive cases in long-term care facilities in the state, and the governor's now warning there are more deaths that are likely to come. Let's bring in Dr. Venkatesh Nagalapadi. He is a geriatrician and president of CFP Physicians Group. Doctor, it's good to talk to you today. We've seen the nursing homes in your state closed off since March, and yet we've heard over the last several weeks some dire reports coming out of the long-term care facilities there. Talk to us about what specifically you have been seeing play out there.
Okay, so it's going back to the beginning of March, the homes have been closed to all visitors. We've had stringent visiting regulations. We've been socially distancing our senior citizens. We don't have visitors come in, and even the healthcare providers coming in have been screened every single day. They're getting tested every 2 weeks. But regardless of all of that, we're looking at a setting. A typical home is 120 beds, 120 patients with risk factors such as age, frailty, presence of chronic medical issues, as is chronic lung disease, congestive heart failure, chronic kidney disease, and immunocompromised status, and also congregate living. So we have 120 frail elderly people living under the same roof. And in spite of every precaution that the home and the staff members do take, they still remain at risk. And one of the things is the reporting requirements started in the May of this year. And I know some homes are retroactively reporting numbers, but that kind of gives us why there's been a sudden increase in the numbers in positive cases in nursing homes. If you look across the country, we have about 1.4 million people in skilled nursing facilities. We have 180,000 positive cases in skilled nursing facilities, which accounts for almost 10% of the population. And if we look at the number of deaths caused because of COVID, it's almost 45,000 in nursing facilities, which accounts for about a third of the deaths in America. So
yeah, I mean, those numbers, 9,500 cases in the state, as you say, a conservative estimate, is still a pretty shocking number. You've pointed out that a lot of these nursing homes have had to set up these isolation facilities for patients that have been discharged from the hospital, but that are still carrying the virus and so need to be isolated separately. There were some concerns about nursing homes not being able to meet that capacity. What are you seeing right now? More importantly, do you have the resources in place as you anticipate additional cases moving forward?
True. So the challenges are twofold. So if the standard of care at this point in time is we consider someone who tested positive for COVID continues to be infectious for about 10 days following the positive diagnosis. And someone with an immunocompromised status, as our frail elderly are, we're looking at 20 days where they continue to shed virus and so on and so forth. So that being said, when someone's admitted to a skilled nursing facility with a known resolved case of COVID, we still treat them as isolation patients. We keep them in a private room. Anyone entering or exiting the room has to have full PPE, which includes N95 mask, which includes face mask, which includes full protective gowns, and also gloves, and also the education that goes along with the proper use of PPE. So that has been continued to be an issue, and that's being handled extremely well by the skilled nursing facilities. But the challenges facing skilled nursing facilities have been the lack of access to PPEs, lack of access to quality PPEs. So if you're looking at masks, N95 mask, which is considered the gold standard at this point in time, 2 months ago, it was probably more expensive than gold, and trying to get your hands on good quality PPE was a huge challenge. Thankfully, moving forward, where we are right now, we're doing better than we did before, but we don't have unlimited resources. in a good case
And Dr.
scenario, yes, go ahead.
Very quickly, if we're looking at the curve right now
Mhm.
for this virus, but particularly as it relates to these long-term care facilities, are we past the peak now? Is that your sense?
I don't think looking at this particular population, looking at this particular healthcare setting, I don't think there is going to be a peak and a decline. For the near future, I think we have to be hyper vigilant, thinking that the peak's going to last, extending into the fall and the winter months. We're probably looking at another 4 to 6 months of current situations, and we have to take into effect that come September, it's flu season. And with flu season come other complications such as pneumonia. So we're looking at multiple other factors that play into the mortality and the morbidity continuing to be high in this population.